Hello, and welcome to this video presentation on cardiac anomalies, specifically tetralogy of Fallot, presented by Hannah, Justin, Kelly, and Leah. Let's start with what is tetralogy of Fallot. Tetralogy of Fallot is a rare condition caused by an array of 4 congenital heart defects. As a rare condition, it only occurs in 5 out of every 10,000 babies and is not gender specific. Boys and girls are affected equally. Tetralogy of Fallot, or TOF, involves 4 defects of the heart that can be remembered with the acronym PROVE. The 4 defects include pulmonary stenosis, right ventricular hypertrophy, overriding aorta, and ventricular septal defect, or VSD. Pulmonary stenosis is caused by an obstruction or narrowing of the pulmonary valve from the heart to the lungs. As a result, the heart has to work harder to pump blood through the valve, and not enough blood reaches the lungs. Right ventricular hypertrophy is the direct result of pulmonary stenosis, and by its definition is the excessive thickening of the muscular wall surrounding the right ventricle. An overriding aorta is a defect of the main artery that carries oxygen-rich blood from the left ventricle to the body. With this condition, the aorta lies over the VSD in between the right and left ventricles. This causes oxygen-poor blood from the right ventricle to flow directly into the aorta instead of the pulmonary artery. Ventricular septal defect, VSD, is caused by a hole in the interventricular septum, or the wall that divides the 2 lower chambers of the heart. This hole allows the oxygen-rich blood from the left ventricle to mix with the oxygen-poor blood from the right ventricle. But what causes tetralogy of Fallot? What is its etiology? While the cause of TOF is unknown, during pregnancy, poor nutrition, viral illnesses, alcohol use, age, and diabetes are all factors that can increase the baby's risk of TOF. Hereditary and genetic disorders, such as Down syndrome, can also contribute. The pathophysiological consequences of TOF is determined by the degree of pulmonary stenosis. With a lesser degree of obstruction, blood is shunted from left to right, but can favorably enter the pulmonary valve to become oxygenated. With a higher degree of obstruction, blood is forced away from the pulmonary valve and exits the heart without ever becoming oxygenated. What are the signs and symptoms? A significant sign of TOF, more commonly seen at birth, is cyanosis, or a bluish tint to the skin, lips, and fingernails. Those with a mild form, or pink tetralogy, due to a lack of cyanosis, present the signs and symptoms of congestive heart failure, but will become cyanotic over time. How is tetralogy of Fallot diagnosed? TOF can be diagnosed with a physical exam by looking and listening for signs of a heart defect. Signs such as cyanosis, rapid breathing, or heart murmurs. A cardiac echo, EKG, and a chest X-ray are just a few of the tests that can further confirm the diagnosis. But how is TOF treated? After a diagnosis, an infant with TOF undergoes open heart surgery to repair the 4 defects so the heart can work as normally as possible. This is called complete intracardiac repair. What is life like with TOF? Most children with tetralogy of Fallot survive to adulthood. However, they may require long-term care from specialists for problems developed later in life. This concludes our video presentation. Have a wonderful day.
Created using Powtoon.